Hi guys, welcome to PI Yoga. I am Priyanka Nair and thank you very much for watching this video. I hope you all are doing good and taking good care of yourselves. In the last video, I spoke about stress, different types of stress and how stress affects our physical and mental health. In this video, I would be talking about the most common mental health problems caused by stress, which is depression. But before I start talking about depression, I want to begin this video with this one small thing. Guys, please understand there is nothing to be ashamed of, or there is nothing wrong with depression or any mental health condition for that matter. When you look at a person or when someone is suffering from diabetes, do you look at that person and say, oh, diabetes, ha? We don't do that, right? So why do we have this expression or reaction, or maybe we don't show it but then it's there somewhere in the head, like अरे ये तो पागल है. Why do we have it? It's very common. It's as common as getting diabetes or high blood pressure or maybe obesity, heart disease. So let's understand what exactly depression is, what are the causes, what are the symptoms, and let us try to break this chain of treating a person with mental health condition differently. That is the whole purpose of this video. I hope it reaches out to as many people as possible, and if I'm able to even help one person, I think that solves my purpose. So let's start with this video. Let us try to understand what exactly depression is. I'm not going to use any technical terms here, going to keep it very simple and basic. Let me ask you this question. Have you had those days where you wake up in the morning and you're feeling low, you're not feeling too good, you're upset, there is a sadness and you don't know the reason, you are struggling to even get up from the bed, you're forcing yourself to perform the everyday activities? Yes, we all have those days, which stays for few minutes, few hours, maybe for a day, and then the next day you wake up and you're fine, you're good to go, and you're back to your normal self. Now imagine having to deal with these feelings on a daily basis. Now it's no longer one of those days that we talk about. It's more than that. Something which is happening to you on a daily basis will take a toll on you. It will start affecting you and things related to you. For example, it will affect your work, personal and social life, your relationships, your mental and physical health too. Guys, please understand the difference between having one of those days feelings and experiencing it on a daily basis. So when you see the pattern that it's happening to you on a daily basis and it's been there for weeks or for days or for weeks, that could be a sign that you could be dealing with depression. Let's talk about the symptoms of depression. The symptoms could vary from person to person. So the symptoms are irritability, anger, sadness, anxious, restlessness. You find it difficult to enjoy, or there is no interest in doing the activities or the things that you usually like doing. You start distancing yourself from your friends and family. There's a feeling of being low, feeling of hopelessness. You start feeling or you start thinking that nothing good can happen to you. Only sad or bad things are meant to happen. You can never see happiness in life. You might have suicidal tendencies or thoughts. You might take to some form of addiction like drugs or maybe drinking and smoking. There may be lack or reduced sexual desire. You might notice certain changes in your appetite. Either you are overeating or you're not eating. Either you're oversleeping or not sleeping at all. You are constantly tired. There are pain and aches in the body. You might have digestive problem. You might have a breathing problem. So these are like common symptoms when you are dealing with depression. Let's talk about the causes of depression. There are different causes like a history in the family, changes in the hormone levels, post-surgery reaction, postpartum depression, which is very common, losing a loved one, losing your job, marriage problem, relationship problems, money problems, your breakup, divorce, not being able to cope up with a traumatized or a stressful situation. And then to add to this existing list of causes, it's the unhealthy and hectic lifestyle that we all live. And then there is this new social media thing which is going on, which is creating a lot of stress, constant pressure of being in the limelight, to be the next big thing, to achieve everything in like one day or maybe in a very short period of time. It's creating a lot of stress, and then we don't even realize it. But then yes, it is definitely adding to this existing list of causes of depression. How to deal with depression? There are simple ways to deal with depression. First would be to bring a change in your lifestyle. Try to have a healthy lifestyle, eat healthy, do things which is going to make you feel good, have a positive attitude towards life, change the way you look at everything. Know that in life there is going to be sadness and happiness, it goes together. Know that okay, there will be situations, there will be times which is not going to be very pleasant, but then you can't run away from it. So have an optimistic approach towards life, which will definitely help you to deal with the situation. Along with this, start indulging in some physical activity which will help you to release or let go of all the negativity. Because when you practice, when you do any physical activity, it releases the good or the happy hormones, which helps you to deal with stress. So choose any physical activity that you like doing. And since I am a yoga teacher, a yoga practitioner, and yoga has definitely helped me, so I would like to talk about yoga for sure. Practicing yoga asanas, meditation, breathing exercises will definitely help. I'm not saying it will help you on the first day itself. It might take few days, weeks, months also, but then it definitely helps, and it helps you in the long run. There are different yoga asanas that can help. Practicing Surya Namaskar on a daily basis works. You can also include poses like your Talasana, Trikonasana, then the balancing poses like Vrikshasana. Again, works like anything. It helps you to concentrate better. You can practice Paschimottanasana, Purvottanasana, Navasana, maybe Marichasana, Baddha Konasana, then Urdhva Dhanurasana, Setu Bandhasana, Balasana, Shirshasana, Salamba Sarvangasana, and then definitely Shavasana. Finish your practice with Shavasana because it is going to give you that extreme deep relaxation. So try to get into this practice where you are doing or performing all the asanas on a daily basis. If you know how to do it, please practice it every day. If you are a beginner, you can either join a group class or you can get a teacher home where you can practice every day as per your needs. Along with practicing asanas, try meditating every day. It works. Maybe you start with 1 minute and eventually you increase the duration, but then start doing it. Practicing or meditating every day helps. Along with this, you can include breathing exercises like Brahmari, the humming bee breath, or Nadi Shodhana, the alternate nostril breathing. It works like anything. The days where you think you need something to charge you up or pump you up, you can practice Kapalbhati or Bhastrika, because it is a heat-inducing pranayam, so it generates heat inside the body and it helps you. So these are certain things that you can do on a daily basis, which will definitely help. But remember, you will be doing this along with the medications. This is yoga, or practicing yoga or doing all these things. It's an alternative option. It's a substitute. So you're not stopping your medications. You will be continuing with the medications that's been prescribed by the doctor. And along with that, then definitely you're going to, you can start practicing the things that we've already discussed. So that's about it, guys. I hope you find this video useful, and if you have any questions or queries related to today's topic, please do feel free to mention it in the comment section below, or you can also send me a message. Please share this video. Let's try to reach out to as many people as possible, and let us try to help whoever we can in whatever ways we could. I'll see you soon with another video where we'll be talking about another topic which would be related to mental health problem. Till then, stay safe, keep practicing, do things which is good for your mental and physical health, and I'll see you soon. Take care. Bye.